Greetings. Welcome to this community update that I'm calling The Review. Now, around a fortnight ago, I contacted several key organisations, asked them to immediately address this matter of ethnicity-related vulnerability to Covid-19. Since then, many have responded, some with fancy words, others with action. First I received a response from NHS England, and on their blog page there is now a welcome entry acknowledging the need for extra support and protection of its minority ethnic staff. They also state that they are working with local Freedom to Speak Up guardians, and this is a group I haven't heard of, but it does sound positive. The response by NHS employers went even further. They've stated that they've actually provided guidance now, formally recognising race alongside age, disability and pregnancy as factors that place staff at risk. They also suggest on their website that risk assessments should be done in discussion with staff, recognising that some elements will require a sensitive approach. Now, this is a very important point, for existing power differentials, and by that I mean the politics of privilege and deference, all mean that many workers are simply too frightened of losing their salary, or worse, their job, if they admit to feeling scared or being vulnerable to increased risk. They just don't want to be seen as causing trouble, and they can't afford to. They need to pay rent and feed their families, so they're going to keep risking their lives, shielding the less vulnerable and the more privileged. Some of us need to step up and become their advocates. I say this because last night I was watching Channel 4 News, and they explained many of the assessments taking place in the NHS have been a tick box exercise, leading to no change. NHS employers has made some reasonable suggestions that line managers should move those at danger to lower risk areas and tasks, and they should also limit their exposure by reducing shift lengths and where possible engaging with remote working. Now, I don't know why this is not happening, as these are all very doable approaches to redeployment. The UK has seen some 36,000 people lose their lives to Covid-19. But in the US, the death count for African people, where we are more than 2.4 times more likely to pass away from Covid-19 than Europeans, is over 20,000. Please look at the report The Colour of Coronavirus by the APM Research Lab. The facts are really clear. Now, Trump, as you can imagine, is doing the same thing to protect African, Asian and other people from minority ethnic communities as Boris is doing. That is, nothing. In the world of politics, things are moving so slowly. In fact, MPs are actually about to go on another 10-day holiday. The government's health and safety executive still fails to recognise ethnicity as a factor that makes workers vulnerable to Covid-19. We can only hope that one day someone there will wake up, recognise and start to address the epigenetic impact of structural racism on society. Truth is, if they don't get it now though, after all these deaths that are being incurred, they probably won't get it. They probably don't want to get it. Anyway, this week Prime Minister's questions open with a question from the MP Claudia Webb.
We now go over to Claudia Webb. Claudia Webb.
Thank you, Mr. Speaker. The government keeps saying that this virus doesn't discriminate, but that isn't true. The Office for National Statistics, the ONS figures show Black people, African and African Caribbean people are 4 times more likely to die from COVID-19. It is also disproportionately high for Bangladeshi, Pakistani or Indian communities. What is the Prime Minister going to do now about this? And will he act now?
It was a good question, and as usual, Keir Starmer, the leader of opposition, failed to use one of his questions to follow up on this. Anyway, Prime Minister Alexander Boris de Pifel spoke about a rapid review being published by the end of the month, as if more paperwork is the action we need.
Prime Minister.
Yes, Mr. Speaker, as the Honourable Lady may know, we are looking at all the comorbidities associated with coronavirus, all the reasons why people may be disproportionately affected, and a rapid review is now being conducted by Professor Fenton, who will report at the end of the month about particularly vulnerable groups, and we will be taking steps to ensure that they are protected where that is appropriate.
Hold on. Where appropriate? So this isn't a matter of when, this is now an if. If it's appropriate.
Protected where that is appropriate.
I suppose a government taking urgently needed action to protect and save lives is not something that should be compulsory. Wearing face coverings and practicing physical distancing and good hygiene, testing and tracing for spread, even protecting children and teachers in schools and elders in care homes are currently all voluntary acts.
Quite a few of the measures that we have put in place to help to control COVID are not mandatory. So it's not mandatory to wash your hands or to social distance, but we do rely on people to make good decisions and to make sensible decisions.
Anyway, Yesterday I finally received an email from Professor Fenton. Now he's the person in charge of this great rapid review report. His email reveals that he's been doing a lot of talking with a lot of people, but none of it inspires me with confidence. Now I hope I'm proved wrong.
And finally, Professor Fenton, I know that you're leading the government review into the disproportionate impact of COVID on those from BAME backgrounds. When will that be published? And do you feel there is enough trust in that review? Because there have been calls for a public inquiry as well, because they feel that the focus is limited.
So the review itself will be complete by the end of May, and we're looking at a number of factors which can disproportionately affect Black, Asian, and minority ethnic communities when it comes to COVID, from diagnosis to severe disease and death. And we are taking a view of looking at the clinical data, but we're also engaging hundreds of people around the country to really understand some of the context for this disproportionate burden of COVID on Black and minority ethnic communities, and what more can be done by all of us to reduce the risk of transmission and, of course, severe disease.
You see, in case you don't know, let me make this clear to you right now. This review, which they keep talking about, will not be looking exclusively at ethnicity risk we have been calling for. Instead, it's looking into general vulnerabilities to COVID-19. Maybe you ate too many biscuits, does that make you more vulnerable? Or if you're wearing a polka dot face mask, does that make you more vulnerable? What if you're not a Christian, does that make you more vulnerable? It's kind of like when the government promised an independent inquiry into Islamophobia, and when as soon as it could, watered it down and turned it into intellectual exercise exploring any form of prejudice or discrimination. And I bet you Afrophobia won't be covered. Anyway, Fenton's PhD report will now be published at the end of the month. That's after the Prime Minister returns from his holiday, and when we're expected to be forced into sending children back into primary schools the following day. I wonder how long this rapid report will be discussed after publication. Remember the interim Grenfell inquiry report, anyone? So what next? Well, we've got to deal with the school situation soon. But first, and it's related, we have to help get risk assessment and protective action for all vulnerable people. You see, while it's great to see the NHS slowly moving to shield its staff, the problem is not only in health and social care, it's in all frontline industries. From school teachers and assistants to park wardens and traffic workers, from house cleaners and supermarket staff, from security to hospitality, even the local post person. My postie this morning didn't have any face covering. He's a cool guy. Look, we can't trust the government's R figure. It's guided by as much politics as it is by science. Without widespread testing in the community and with the government's covert end of lockdown, we just don't know how exposed any of us are. Which means we're all going to have to wait a couple of weeks to see the results of this experimental second wave herding that's currently taking place on UK streets, beaches, parks, playgrounds, and soon schools. And this is all while MPs, private schools and rich folk are shielded at home, some with their low-paid, vulnerable migrant nannies, cooks and cleaners doing their dirty work for them. Remember, we are not and never have been all in this together.
Thousands of sunseekers came from far and wide, taking advantage of the new rules allowing travel. As the temperature rose, the seafront got more and more crowded.
So I'm going to leave it there. As Yoda didn't say, do or do not. There is no if. If you can do something to help, please don't try, just do. I mean, what are you waiting for? Another government review? A debate into that review followed by an inquiry into the review of the review?
And so will it include recommendations or data just telling us what the situation is? Because I think people will want to see some form of change and the government commit to it.
Absolutely. Well, certainly the data will identify areas for us to act, and the recommendations arising from the engagement sessions will be put forward for consideration as well.
Just do something. This, as is the premature opening up of schools without enough evidence to say it's safe, is too serious an issue to be sitting on the fence. And I'm going to close with a reminder to be loving, be safe, and as always I'm going to ask that the ancestors continue to guide and protect us. Ashe.